My name is Dr. Sunday Ajayi, and today I'm going to talk about how we manage heavy menstrual bleeding. Heavy menstrual bleeding is very, very common and is one of the commonest cause of referral to the gynecologist. Most of the time, patients in the reproductive age group, about over 40% suffer from this problem, in which the monthly period is very, very heavy. At times women have blood clots using several pads, and at times this can affect their lifestyle and quality of life as well. Um, so the most of the time, the woman will then present to the general practitioner with complaints of heavy menstrual bleeding. And as per the NICE guidelines now, it's not about the amount of bleeding, it's when a patient says the period is heavy. So we need to take it seriously that the periods are heavy. For some women, it can cause them to have a low blood count, what we call anemia, and some have to be then prescribed iron supplements to build up their hemoglobin. So we get a referral from the general practitioner. Hopefully, they might have requested for scans. Some blood works might have been done. But when we see them in clinic, we then take a full history again, checking on their um, checking on the when the symptoms started in terms of the flow of the periods, the regularity of their periods. We need to find out about their past obstetric and gynae history. Have they had any gynecological procedure or surgery done before? Obstetric history is also important, and also we need to also rule out any blood disorders. So once that is a full history has been taken, then we then proceed to examination. So we need to do a full examination of the abdomen and the pelvis, because we know that at times a patient can have a fibroid, which is one of the commonest cause of also heavy menstrual bleeding. By and large, generally, the commonest cause of heavy menstrual bleeding is what we call dysfunctional uterine bleeding, in which we have checked for all the causes and nothing has been found. This is majorly hormone related. Other causes of heavy menstrual bleeding, like I mentioned before, is when a woman has a uterine fibroid. Uterine fibroid are benign tumors of the muscle of the womb. These are not cancerous, but they can cause heavy and painful periods. Also, we need to check for we need to find out about the cervical smear history, making sure that that is up to date, and making sure that we've not missed anything at all. Um, so after the examination, then we then proceed to investigation. So checking the full blood count, hopefully it has been done by the general practitioner, and also if the pelvic scan has been done, that will check for any fibroids, and also check for any uterine or endometrial polyps, which also can cause heavy menstrual bleeding. The treatment options for heavy menstrual bleeding can be divided into broadly conservative management, medical management, and surgical management. In terms of conservative management, it's just about being supportive management in terms of giving iron supplements if there's low hemoglobin, and also normal analgesia. For most patients, they will require more than that, and then that moves us to the medical management, which you can have non-hormonal methods and hormonal methods. The non-hormonal methods basically giving tranexamic acid or mefenamic acid to help to reduce the flow of the bleeding. For the hormonal methods, you have we can offer you can offer the combined oral contraceptive pills or the progesterone only pills. They work very, very well as long as there's no contraindication to use them. And also we can also offer the Mirena coil, which is the progesterone coil. And this is recommended as the first option from NICE guidelines. That's the National Institute of Clinical Excellence. They say they recommended that we should be using the Mirena coil as the first point in terms of managing heavy menstrual bleeding. In terms of the next step, to manage if the medical methods are not successful, then we can move to the surgical methods. And one of the surgical methods that we use is what we call endometrial ablation. This should be offered to women who have completed their family and they don't desire any fertility. If a woman is still desiring fertility, then this will not be a good method. For women who has fibroids and they want to keep their fertility, we can also offer them mammectomy. This can be done by keyhole surgery, laparoscopic mammectomy, or it can be done via through hysteroscopy, depending on where the fibroids are. Much of the fibroid that causes heavy menstrual bleeding are the submucous fibroid, which is the fibroid that is very close to the lining of the womb. If these methods don't work or is not suitable, and the patient has completed a family and is not designed to keep a womb, then if everything has failed, then we can also offer hysterectomy. And hysterectomy can be offered in various. It can be done through various methods. It can be done by keyhole, and that's through laparoscopic hysterectomy, or we can do through vaginal approach, vaginal hysterectomy, or open method, open hysterectomy, depending on the findings on examination. So these are broadly the options to managing heavy menstrual bleeding. Thank you.